qui sont au téléphone, comme à l'habitude, s'il vous plaît, mettez votre appareil en position muet afin d'éviter les retours de son. Si nous devions avoir un retour de son, nous serions forcés de fermer la ligne. Dr. Drouin, la parole est à vous.
Dr. Drouin, the floor is yours. Good afternoon, everybody. Hello, Mrs. Bélanger. Well, first, I would like to congratulate and thank the Montreal population who have followed us over the past few months in this suppressive approach. I think it paid off for Montreal. We can see this. I used to say that we were delaying the third wave, but now we have truly avoided, in one of the biggest cities in Canada, we have avoided it. And I can't even imagine what would have occurred if we had not avoided this third wave. And especially in a context where I don't think that right now we would be talking about reopening and deconfinement of sectors if this third wave had occurred in Montreal. So, of course, it's because of the population, the approach, the fact that the vaccine coverage and the vaccination campaign are going quite well, and that is why today we have this good news for you. Of course, prudence paid off for Montreal, and I think that the message is that the pandemic is not yet over. We still have a bit of work to do together, and we must continue to be prudent in certain contexts. Over the past week, if we look at last week, we had close to 1,483 cases, so an average of around 215 cases a day. So we're really at the limit of the red and orange. But we're still in the red zone. Over the past few days, we had a drastic decrease in the number of cases, which is also associated to decreased screening. So we will wait a few days to see if truly this decrease in the rate of incidence and of positivity continues. But overall, I think that we are on the right track. What we are seeing, however, whereas we had a rate of incidence that was very high with kids in school, now we can see that this is moving to the 18 to 44-year-olds. The territories that are the most impacted are Parc Extension, Bordeaux, Cartierville, Saint-Laurent, Pointe-Saint-Charles, and Snowden. The rate of positivity is quite stable, around 3%. As I said, there's a significant decrease, probably linked to the long weekend, to the holiday. But I would like to remind you that it's important, and even more during a reopening period, because we're increasing our contacts, we are increasing our exposure to social contacts. So we must keep the reflex of getting screened if we have any symptoms that look like COVID. If you were in contact and public health asked you to get screened, it's extremely important that you go, because of course it's at the heart of our capacity to understand the chains of transmission and to block them quickly. So the 18 to 24-year-olds, I invite you, of course, if you have any symptoms, and especially since it's allergy season, please don't hesitate to go get tested and, of course, go get vaccinated. When it comes to the outbreaks, as I said, we have more than 216 active outbreaks. The virus is still circulating, but overall, these are small outbreaks that are well controlled, and we can see that the situation is reflected in the type of outbreaks that we see. So there's a decrease of outbreaks in the workplace, 84, 64 in schools, 26 in daycares, and only 12 in care settings. However, we are starting to see a slight increase of outbreaks in the community, and that's normal because, of course, there are more contacts in parks. For example, 9 of our 16 outbreaks in the community are associated to contacts that people had in parks. So even if we're outside, of course, we can have fun with the outdoor gatherings, but maintain the physical distancing and don't share food, glasses, or any other objects. And I think that there is a way to have safe practices outside. And of course, if you are involved in an outbreak, continue to collaborate with public health. We don't want to police people. We will not judge your behaviors, but it's very important for us, especially during the reopening, to be able to trace back the chains of transmissions, to come back to the source so that we can identify all the contacts, because that is what will help us avoid super spreader events. The population is not completely vaccinated. We have 50% of people who have received a first dose. And so when you get your first dose, you are not immunized immediately. It takes 3 weeks. And even then, the first dose does not have maximum efficacy. So there's a proportion of the population who will require a second dose in order to have complete immunity. When it comes to vaccination, it's going well. The objective remains a 75% vaccine coverage for 12 years old and up. We're aiming for the 24th of June, and Montreal will attain this objective with the other regions. So more than 50% of Montrealers 12 and up have received at least one dose. When we look at the appointments taken over the next 2 weeks, we go up to 69%. So it's clearly very encouraging. And of course, we have reached our objectives with the more vulnerable and older groups. So 75% has been reached in the 55 and up group. And of course, I invite, we still have a few thousand people to reach in the younger groups, so the 40 and ups, 55 and up. If you have not been vaccinated yet, it's still time to make an appointment so that we can reach the 75% globally, but also in all age groups. So we're improving our strategies. Mrs. Bélanger will talk about the strategy in schools for the 12 to 17-year-olds. We are finishing the RPAs and HLM for the second dose, and as soon as we have more vaccines for the Montreal region, of course, we will add more walk-in because we see that the younger population responds quite well to this form of service. So the 18 to 24-year-olds, we invite you to go get vaccinated. Please don't hesitate to get screened, and we are continuing to follow the public health measures, even outside and even with the context that will reopen in order to avoid having an increase in cases associated to this reopening. So I thank you once again for your solidarity, for your patience. I know that we would have all wanted to reopen very quickly and go to the orange alert level. I think we still have a time ahead of us, but we're heading in the right direction, and that is thanks to your efforts and our collective efforts. Thank you very much. Hello, everybody. Once again, this afternoon, I'm here on behalf of the Command Center, that groups together all the CEOs in Montreal, the 10 CEOs in Montreal, the CEO of Urgence Santé, the General Director of the City of Montreal, and the CEO of Civil Security. The Command Center remains open, so we are continuing to sit in this Command Center. As long as we're in the red, it's very important that we continue this coordination. The health network, well, we can see this. There's a bit less pressure on the healthcare system because of hospitalizations. Today, we have 169 people who are hospitalized in the different Montreal hospitals, including 55 in intensive care units, following a diagnosis of COVID-19. The curve of hospitalizations continues to be flattened gradually, but we are observing a slight plateau. I want to take this opportunity to show you this. A picture is worth 1,000 words, and we can see that currently, over the past few days, it's a decrease, a low decrease. It's a slight plateau, so it's far from over. As I mentioned earlier, what we're seeing in green here represents the 169 people who are hospitalized with COVID-19, whereas what we're seeing in gray represents the people who are in intensive care units, so 55 people. And it's interesting to see that there were some days that were extremely difficult in the network. We can see this, and we're truly below what we have seen in the past. The situation in emergency rooms is still fragile. The situation, on average, in emergency rooms, there's a rate of occupation that is very variable, but on average is at 120%. That means that 20% overflow. So also there, a lot of pressure on emergency rooms currently. Thanks to all the efforts that Dr. Drouin mentioned through Wave 1 and 2 and our learnings, I think that we are truly in a phase of recovery. When it comes to our emergency measures, we want to come back to a progressive return to normal. However, the healthcare network has been impacted for over a year, and we can see that we have a rate of absenteeism that is still quite high in the healthcare network. Not as high as during Wave 1, but we can say today that 7% of our staff, so we're talking about healthcare and social services workers, are absent because of a work accident or for any other reason. 7% represents approximately 10,000 people who are not at work in the healthcare system. So it's quite significant. We truly must continue to make efforts to protect our workers and so that they can also come back to work as quickly as possible. We know that we were delayed in surgeries, in diagnostic services, but all hospitals currently are opening up as much as they can. When it comes to the vaccination campaign, you know that we started the vaccination for 12 and ups, and the campaign is going very well. We're proud of the vaccination that we're seeing in Montreal. Montrealers are there, answer the call. We are getting close to our target of 75% in several age categories, and we surpass it in several categories as well. So here, if we look at this table, we can see that, for example, at the top of the graphic, for the 85 and up, it's 88% vaccination rate. So it's very positive. And when we look above for the 55 and up, we've surpassed our objective. My message, or the challenge for you, is, yes, for young people, but I would tell you the 40 and ups, 45 and ups, 50-year-olds, they're slower to take their appointment. I'll put it this way. So young people, we just opened up to them. So obviously, there's a lot of young people that we have to reach, but we just opened to the 12 to 17-year-olds, and we also opened last week to the 18 to 25s. And they're there, they're making their appointments, so I invite you. I don't want to make a competition between adults and younger people, but almost, because I find that there's stagnation in the 40 to 45-year-olds. There's something happening there. So we invite you to please make your appointment. We have vaccination in several centers in Montreal. There are mass vaccination clinics, the smaller clinics. There's close to 400 drugstores and pharmacies that offer vaccination, so please don't hesitate. In Montreal currently, it's 1,258,000 people, or doses, that have been administered. So things are going quite well. For the healthcare workers, I often was asked this during press conferences, so today I'm proud to announce that 80% of healthcare workers and social services workers have received their first dose, and 35% have received their second dose. So naturally, we are continuing to vaccinate in different ways. You know that there's also drive-through vaccination. We tried that out last week with the CIUS de l'Ouest, but I'll remind you that there's a Circuit Gilles Villeneuve on the weekend. So it's a vaccination is offered there for cyclists, actually. So this weekend, from 10 to 2 p.m., it's vaccination at the Parc Jean Drapeau on the Circuit Gilles Villeneuve, and it's a pit stop vaccination. That's what we call it. So whether you're on a bike or in a car, well, first of all, you can visit the garages for Formula One, and you can also get a vaccine because our teams have organized their vaccination processes there. So things are going well. My message is let's continue to make appointments. Now, for the 12 to 17-year-olds in schools, there are several approaches, whether it's in public schools, in specialized schools, in private schools. The objective is to truly reach everyone from 12 to 17. At 12, there are some kids who are still in grade 6, so we will go in elementary schools to reach those 12-year-olds. For high schools, it's going to be mixed. In certain cases, the schools will go to the vaccination centers, and in other cases, the mobile teams will go directly to the schools. So this is being organized now, and we will look. As of this week and for the next few weeks, 50% of the doses will be kept so that we can reach all young people from 12 to 17 before the end of their school year, which is ending in June. So we're getting organized. The best way to get an appointment for the schools is to go through the CIUS, the local CIUS, to get all the details. Thank you.
Good afternoon, everybody. Bonjour, Madame Bélanger. First, I want to say thank you to all Montrealers for their contribution in preventing this third wave and supporting us in our suppressive approach during the last few months. I think it paid, and we have avoided a third wave collectively. We wouldn't be talking about reopening different sectors of activity right now if we had been in a third wave in April or beginning of May, so I think we can rejoice ourselves. We were vigilant, and I think it paid, and still, while we are reopening certain activities, we still have to be vigilant in the way we reopen the different sectors. If we look at the epidemiological situation in the last week, we had 1,483 new cases. It leaves us in the red zone, but really we are flirting with the orange zone. We've seen in the last couple of days that we have really low numbers, but they are associated with a low level of screening in the population, probably linked with the weekend, the festivity of the weekend. So we'll see if the tendency is pursuing in the next couple of days. The change that we are seeing is in the incidence rate. We mainly had high incidence rate in school-age children, but right now we are seeing an increase in the 18-24 years old group. So we really, and in this group, we also have higher positivity rates. So we really encourage them, the youth, to get tested if they have symptoms, if they, of course, have been in contact with a case, to, of course, respect the measures, the public health measures. Even if you have one dose of vaccine, you are not fully immune. So it is important to maintain those measure in place. And of course, if you haven't had your vaccination, your appointment for your vaccination, I think it is time to get it soon. We are still managing more than 216 outbreaks. We are seeing a decreasing in the number of outbreaks in workplace, 84, schools, 64 outbreaks, daycare center, 26, and only 12 in healthcare settings. What we are seeing is a small increase in the number of outbreaks in the community, and this is what we are expecting in the next couple of weeks, because we are reopening those sectors. And we have 9 of those 16 outbreaks where we have an association with parks. So even though we know that the risk is lower outside, do not share glasses or other food or material that can contribute to transmission of COVID. The vaccination campaign is progressing. Our goal is to attain the 75% coverage for the 12 years old and older. At the time we're speaking, we have more than 50% of this group that have been vaccinated. And when we look at the appointments that have been taken for the next 2 weeks, we are reaching 69%. So we're getting close to our objective. So we have a different strategy. In the next couple of weeks, we will do the vaccination of the groups, the school age group 12 to 17 years old. We are continuing the second dose vaccination in HLM and elder residency, and we will add, as we get more vaccine, more sans rendezvous. I forgot how to say sans rendezvous. So we can, because we have seen that youth people are responding well to this form of access. So what I want to say to finish is that even though we are progressing in the right direction and we can be proud of what we have done for the third wave in Montreal, we still have to be vigilant. Get your appointment, get tested, don't forget the reflex of getting tested, and continue to collaborate with public health, because the more we open, the more we have contacts, the more we have to be aggressive in finding those chain of transmission and cutting them down easily. Thank you.
Alors, peut-être avant de commencer mon allocution en anglais.
Before I make my remarks in English, it seems that I mentioned earlier that vaccination on the circuit Gilles Villeneuve, I said from 10 to, it's from 10 to 4 p.m., not 2 p.m., 10 to 4 p.m. as of on the 20th, the 29th and the 30th of May by bike, and the 5th and 6th of June, as well as the 12th and 13th of June. It will be drive-through vaccination from 10 to 4 p.m. again.
Good afternoon, everyone. To begin, I want to talk about the situation of the city's health system. In Montreal, at this time, 169 people with COVID-19 are hospitalized and 55 are in intensive care unit. The situation also is under control in our emergency rooms. On average, the occupation rate is 120%. This very good news allows us to initiate the recovery phase of our emergency plan. That is a progressive return to normal. We are gradually reopening all our services to their pre-COVID capacity and even further. However, the issue of human resources remains more fragile. Around 6 to 7% of employees are still on extended leave from work. Of those, however, only 78 are linked to COVID-19. Now, a few words about the COVID-19 vaccination campaign. More than 1 in 2 Montrealers have had their first dose of vaccine. We are gradually nearing the target of 75%, but we still need to make efforts to target young people in particular. In all, 69% of Montrealers aged 12 and over have been or will soon be vaccinated. This represents more than 1,258,000 people. And more good news, we have reached the vaccination target for health workers. 80% of workers in health and social services facilities have received their first dose. With vaccination opening up to 12 to 17 years old, we are finalizing arrangements for mobile clinic and high schools, as well as primary school for students in grade 6. As for the second dose, we finished giving it to CHSLD residents in early May and are on track to complete vaccination in senior residents by May 31. Finally, we slowly return to normal and start opening up. I want to emphasize all the work done by health network staff. It's totally thanks to your exceptional efforts that we can collectively enjoy a bit more freedom. Thank you.
Merci, Dr. Drouin. Merci, Mme Bélanger. On va débuter la période
Thank you. We will start the question period.
de Radio-Canada. C'est une question et une relance.
One question and one follow-up question per reporter. Question. Hello. The rate of vaccination is lower in some sectors of Montreal. Saint-Michel, Park Extension, for example. There are citizens over there who say that perhaps they don't have enough access to vaccination sites. In these sectors where the rate of vaccination is lower, will you have other kind of solutions, perhaps pop-up clinics, something like that? Well, the responsibility is every CIRS has its own strategies with the community organizations. So depending on, we give the data, and according to the reading of the territory's picture, there's either some door-to-door pop-up clinics, for example, in neighborhoods like Saint-Michel. There's something being done with the places of worship. So we started in several places, and that will continue. Of course, there's the school settings in certain neighborhoods, certain establishments. In addition, they've targeted schools in neighborhoods where there's a lower vaccine rate so that they can go vaccinate, and then they open it up to the parents in the community. So what we've done as well is in certain neighborhoods, we have vaccination in certain businesses, high-risk businesses, but that also have workers from that given neighborhood. So right now it's a combination with mass vaccination because we have to vaccinate a lot of people. And these strategies that take a bit more time, and I have the impression that in June and July we will continue to do these interventions to reach the last percentages of people and also make sure, because it's nice to get 75% or even 80%, I would be very pleased for the entire island of Montreal. But it would be even better if we could reduce as much as possible the gaps linked to social inequalities. I would say that we have around 10 little neighborhoods where we realize that the efforts will be more time-consuming. For the younger people, 18 to 40, perhaps it seems that around 60% have already made an appointment or got one dose. There's 40% remaining. Is that worrisome that there's 40%, or is it normal? Well, we have to continue the efforts, right? The message for adults in that age group is that there's room to get a vaccine. We have to continue to communicate. This weekend, it's a nice opportunity. Those who want to go for a bike ride, go to Parc Jean-Drapeau. We will vaccinate. The big centers like the Palais des Congrès and the Olympic Stadium, we're also there to vaccinate. So please don't hesitate. And we have walk-ins as well. So truly, I think as a network, we have offered all sorts of possibilities. But it's truly important. And young people, well, in my opinion, those that I have seen in my CIUS are there and they want to be vaccinated. There's some excitement there. And I think that we've got young people who want to get their freedom back. So for me, it's a message that I have. We have to go. We are really aiming to reach the 75% before the 15th of June. And I would even say the objectives keep increasing. We will be able to perhaps shorten the delay for the second dose. But for this, we have to get the first dose. So, yes, and I think that young people, the walk-in strategy demonstrates that people like the instantaneousness. So, of course, right now in the campaign, there are some walk-ins, but it's not most of the doses that are dedicated to walk-ins. And probably the further along we get, the more doses will be allocated to walk-ins, because we know that it works with the younger age groups. Question. First question for Dr. Drouin. We know that the Montreal region went to fewer than 100 COVID cases, approximately 20 for Laval. Why is it? What are the details? Why is it that Montreal and Laval are not going to the orange zone like the other regions? Well, like I explained earlier, the numbers of the past few days, the level of screening has dropped by half versus what we usually have. So when we look at our rates of positivity, last week our rate of positivity was at 3%. When I look at the rates of positivity for the last few days, it's at 2.7, 2.8%. So if I had the same number of people who went and got screened, I'd be closer to 180 or 190 cases. So we'll see over the next few days. These numbers a little bit biased, and that's why we have to wait over the next few days to see if that trend, that downward trend, will continue, even if people go get screened more. And we just went into orange in some zones. So we need a certain stability in orange because we know that overnight, if we reopen indoor settings where there's a greater risk, we will increase our rate of reproduction for the virus potentially. So we don't want that to happen. We don't want a yo-yo. So we have to be sure that we can decrease significantly and constant. And that's what the regions that are going from red to orange, they've been in orange for several weeks. So they've got this stability. Montreal will get there. I'm convinced of this. I'm confident. But it would be too soon, especially with the long weekend, to say, to cry victory and say, okay. And sometimes we had some days where we were almost in yellow, you know? My second question, you talked about this. 9 of the 16 outbreaks in the region are directly linked to gatherings in parks. With the nice weather coming, the gradual reopening, is this something that worries you, that these outbreaks will occur outdoors? Well, clearly, the risk is lower outdoors. And when we drill down, and these are not big outbreaks. We're not talking about super spreader events here. They're small outbreaks, but it was just to illustrate that even outdoors, there are risky behaviors, and sometimes people loosen up the measures because people are happy to see each other, so they share food, they share glasses, etc. So I think that there's a way to partake in these activities while keeping certain public health measures in place. And we have to remember that one dose of vaccine does not fully protect, and that is important. When you get vaccinated, it's not magic, and in 24 hours, you're immunized. And it's effective. It's got 60 to 70% efficiency, so we have to be fully confident indoor and outdoors. It's when that will happen when the population will have had its 2 doses. Question? You mentioned, Dr. Drouin, Bordeaux-Cartierville, once again, among the sectors that are the most impacted, and I would add to Marc Birou's question, is there a link between the places where the virus is circulating quite a bit and the neighborhoods that you're mentioning that are probably, it's more difficult to convince people to get vaccinated? You mentioned around 10 hesitant neighborhoods. Bordeaux-Cartierville, is that one of those? Well, it's not the neighborhoods for which we have more difficulty getting a high rate of vaccination. These are neighborhoods where the variant was more present or where the context to control the transmission, it was a bit more difficult to control the transmission. But I'm thinking of Bordeaux-Cartierville and Saint-Laurent. They're in our top 5, but these are 2 neighborhoods that have also seen a significant decrease versus 2 weeks ago. So they're on the right track as well, even if they remain our most impacted neighborhoods. When I name these neighborhoods, all I want to say is please don't hesitate to get screened and, of course, get vaccinated because the risk is more significant in those neighborhoods. But if you feel that you have any symptoms, don't hesitate to get a test because, of course, the virus is still present and there's still some community transmission in these neighborhoods. And you've also mentioned the outbreaks. I was looking today, there are some active cases in the Bordeaux prison. This outbreak, it's relatively contained, but not eradicated. So why is it so difficult to control these outbreaks in prison settings? The latest information that I had on this, well, often it's workers, but the last outbreak was very limited. and we did extensive screening, and we hardly found anything. There was no major closure of units. So currently, it's community transmission that is brought into the prison through a worker, and we can't close as long as we don't have any cases for 14 consecutive days. So the outbreak is considered active. That's why it takes time, but it's not a situation that is concerning me right now. Thank you. We'll go to the telephone.
De la presse, Madame Colpron, la parole est à vous.
Question. Hello. I wanted to know, I was listening to you, and you're telling people to make an appointment. My question is, could you vaccinate more if the demand was greater? Well, currently, of course, most of the appointments for the next 2 weeks are booked. And that's very good news. That means that the population is there. But there are some appointments in pharmacies, a few hundred here and there, so there's some room. And there are some appointments that are open for later, from 2 weeks from now. And that's why I say that as soon as we get more vaccines for Montreal, of course, we will be able to open up more appointments. It's clear that we can only administer the vaccines that we get. If we had more doses, we would open up more appointments, but we see that there's a certain stagnation. There are still some appointments available on Clic Santé. And the other message, don't forget, the walk-in is very effective. For example, at the Palais des Congrès, we can vaccinate up to 300 to 500 people per day without any appointment. So things are going well. That's what we experienced over the past 2 weeks. So you can think about that, and these vaccines are available. Every day, we keep a certain number of doses. And perhaps also I'd mention that we are very alert. Every day, we check with the ministry to recuperate doses from Montreal as well. So that's why it's very important to go on Clic Santé and to follow it closely. And we expect to have more doses within a couple of weeks. So then we will open up more appointments and we will be able to progress in our campaign. But we still have some latitude to offer appointments, so please don't hesitate to make an appointment. Another question? Do you have an explanation on why people 40, 45, 50-year-olds, why are they not taking appointments as much? Well, we don't have an explanation. It's an observation that I've made and that others are also making. Since the 3rd of May, it's been open to the 45 and ups, and it's as if there was a starter takeoff to start making appointments. Whereas when we opened, for example, to the 25 and ups, the next day, people wanted to get vaccinated quickly. Same phenomenon with the 18-year-olds last week. A lot of people 18 and up went to the vaccination sites. They wanted to be vaccinated quickly. It's almost like with the adults, the 40 to 45-year-olds, they're taking their time. The other thing that I want to mention as well, I didn't say this during the press conference, but there's also a lot of business consortiums who offer vaccination to their employees and also to the members of their family. We can think about the Bell Group. There's also the National Bank, the Groupe Jean Coutu. They're with the Bell Center. So there's some vaccination being done there as well. And there are other businesses as well. So that too will help. Perhaps people in their 40s and 50s are saying, well, we'll wait and we'll go get vaccinated. We'll make our appointment with our business. Perhaps that's the explanation. But regardless, we can't wait. While we are in mass vaccination, this is when it's happening. So I would say that there's a certain urgency to vaccinate everybody as quickly as possible. And I would add, and one of the elements to convince people. Right now, when we look at the rates of hospitalization and the risk of being hospitalized with a variant, and now 85% of our cases are the UK variant, we can see that in the 40 to 54-year-olds, it's 70% greater risk of being hospitalized than the previous strain. So in this group, we clearly have a more significant risk of being hospitalized. So there are many benefits to being vaccinated, but of course we want the entire population to get vaccinated.
Pascal Gaxet du journal Métro. Monsieur Gaxet, la parole est à vous.
Question?
Oui, bonjour.
Hello?
Question pour Madame Bélanger.
A question for Mrs. Bélanger.
Alors, vous avez mentionné que les 7%
You mentioned that 7% of people were missing from the health network.
comment ça impacte le réseau de la santé?
How does this impact the healthcare network? And you have some latitude there.
En fait, si je comprends bien votre
If I understand your question well, is how is it going in the network with this absenteeism? Well, clearly we're very tight, right, in our organization of services. There are some shifts where we ask people to do overtime. We dealt with the private agencies as well. So clearly right now, even if we have fewer hospitalized patients, we have a situation, we have a lack of resources in the network. We do have some latitude, and in fact, we have all the latitude to hire people. Every establishment has its own strategies to recruit staff. There's no obstacle there. The problem is that the labor force is not available. They're not present. So to give you an example, this summer, most of the establishments, we've increased the number of hires for students in nursing, in respiratory therapy, students in different disciplines so that they could lend a hand. And of course, they can't do everything in a professional, all the professional acts, but they can contribute. And we hope to keep them afterwards. When they go finish their last year of school, we hope that they will come back. So this is the type of thing that we're doing. We hired many orderlies. This helps. Clearly, it doesn't replace a nurse in the operating room, but in all of our sectors, we will have to innovate and look at working in interdisciplinary teams and integrating eventually other categories of employees. So that is what we're working on. But to answer your question, it's difficult, especially overnight and on the weekends. It remains very difficult.
Justement, je vais aller un petit peu plus loin dans ma question, et cette fois-ci, ça concerne les sites de vaccination.
Now for the vaccination sites.
Avec les plages horaires qui s'ouvrent en fin de semaine et
With the appointments on weekends and at night
la vaccination,
for young people to vaccination,
compliquer la tâche, j'ai l'impression
well, that would be more difficult for you, I imagine.
de la même façon, vous allez pouvoir répondre à cet achalandage.
And will you be able to meet this demand? Well, offering vaccination, and we will be doing this throughout the summer. Obviously, it creates additional pressure on the system. However, in the vaccination centers, there are many retired people who came back to work in the different vaccination centers. And these retired people would not necessarily go back to work in a hospital, for example. They're ready to come back for vaccination. So this is not staff that we're depriving ourselves of. There's a lot of people as well who now have the possibility of vaccinating and who could not anyways come work, for example, in care units at night or on the weekend, like speech therapists, nutritionists. Right now, they're helping us out with a vaccination campaign, but for example, they can't go work overnight in an emergency room. So we were careful in our vaccination centers. We use staff who will not impact hospital services. So that's what we're doing in great majority, I would tell you. Thank you. We've got one question left in French. Catherine Gauthier. She says, Dr. Drouin, last week on Radio-Canada, you already had reservations to come back into the orange zone on the 31st of May. But Minister Dubé said that he was confident on the same day, but now we can see that it has been pushed back. Did you convince the government yourself to act more prudently, and if so, why? Even if the government had set dates so that the population could have an idea of the reopening plan, we have always said that the decisions would be made according to the epidemiological situation. I didn't have to convince them. The numbers speak for themselves. Clearly, we see this. Montreal and Laval, it's a bit too soon to deconfine safely, and nobody wants to play yo-yo. All the sectors want to reopen, but they don't want to have to close again. So I think that, the numbers speak for themselves. We will now go to the English questions.
Bonjour, Dr. Drouin. I just wanted to go back to what you mentioned about the lower levels of testing in the city and how it's affecting our numbers. Moving forward, if more people don't go get tested, how do we truly get a grasp of where our numbers are at?
Of course, we expect that the incidence rate with the vaccination campaign that is going on will continue to reduce. At the time we look at our positivity rates, and we know also the neighborhoods that have higher incidence. So we are looking at how the number we have data on each neighborhood on the number of people that have been screened each week, if it's reducing or not, and the positivity rate. So we're following those two indicators to see if it's a real drop in the positivity rates or it's just an artifact linked to an increase or a decrease in the number of people that are getting screened. But the message I want to say to the population is it is important to continue to get screened, even if we are reopening sectors. It is even more important to continue if you have light symptoms that are linked to COVID-19, because with one dose of vaccine, sometimes not all the population is well immune, and we had some outbreaks where it was people with light symptoms of COVID or flu-like symptoms, and they thought it was allergy or they just didn't feel well, but they said, well, I got my shot, so I'm immune, but it was COVID. So we are asking the population to not hesitate to get their screening test, and it is going to be available during the summer as it is right now.
Thank you. And you mentioned earlier that we're flirting with the orange zone right now, but you'd rather see it be stable for a little bit longer before making the switch. Are you confident in that June 7th date that's been put out there for turning to orange?
The June 7th? Of course, if really what we are seeing and what we've seen in the last couple of days, if it continues for 14 days and it continues to decrease at the speed that we're seeing, I think I would be confident. But at the same time, I think there is something like an artifact linked to the number of screening tests that we had. So I think we will reevaluate this situation Sunday or Monday to see if it is a real tendency, and if it's not the 7, it's going to be soon. I think so.
Thank you.
Merci. On va passer à une question de Gloria Enriquez de Global. Dr. Drouin, my question is about outbreaks in parks. What are the ages of people who are part of those outbreaks, and how big are these outbreaks? How concerned is public health when you see the amount of people in Montreal parks and their behavior?
I do not have the age of I would have to ask my teams, but what I have for information, they are small outbreaks of less than 10 cases. So I could have the information given to you afterwards.
Okay, and then are you concerned about the amount of people in Montreal parks right now?
But I think what we are seeing, it's an effect of spring, an effect of the other places that are not still open. So people have to, it's quite the only places we can gather right now. So with the reopening of the terrace this weekend and the backyard of homes, I think we're going to see maybe less people in park. At the same time, for many Montrealers, park are their only backyard. So I think the message I want to say is that even though we're outside and that the risk is lower, we have to maintain the distanciation, and of course do not share glasses, cigarettes, or whatever food with friends or people that are not in your family.
Thank you. On the phone right now, Lauren McCallum, CBC. Lauren, you can ask your question.
Thank you very much. Hello, Dr. Drouin. A little question. You mentioned certain neighborhoods in Montreal that are still not hitting the vaccination target, and there's still a bit of issue with the number of cases. Can you tell me what will you be doing to get people in those neighborhoods vaccinated?
There's a lot of strategy. We have brigades in those neighborhoods that do door-to-door outreach. We have some specific clinics that are done in parks, or we have some in worship places. And of course we work with pharmacy, because pharmacy are still really proximity places where that can reach vulnerable population. And right now we're also doing some outreach in schools with the strategy to reach the 12-17s in some of the neighborhoods with really low coverage. We will invite a little bit larger the community to get their shot. So there's different strategies that are going on, and that will continue in June and July till we get high coverage in those sectors also.
Okay. My second question has to do with schools and vaccinating 12 to 17-year-olds. There's kind of a hybrid approach. Can you tell us about that, please?
But we have of course, every 12 to 17 years old will have access to a vaccine. The arrangements are done. Each CS are making arrangements with school and centre de santé scolaire. So for certain schools, like I said, in specific sectors where we know that we want higher level of coverage, and with the capacity that we have, we will have mobile clinics that are going to go in those schools. And for other schools, it's going to be the reverse situation, where we will have a transport and specific days that are going to be reserved for those schools to make sure that we vaccinate all the children in one class after another. So it's an hybrid situation, and of course parents can also take appointments for their youth right now if they want in mass clinics. So we at the time we're speaking, I think we have more than 20% of youth in this group age that have already gotten their vaccination or that have an appointment. So it's going to be really different strategy to reach them.
Il nous reste 2 journalistes en anglais. On débute avec Caroline Van Vardigan de CTV. On va terminer au téléphone avec Jacob Cerebrin de la Canadian Press. Dr. Drouin, question de Caroline Van Vardigan. Considering the outbreaks happening outdoors and your reminder to people not to share food and a drink, are you at all concerned about the opening of terraces and outdoor gatherings of 8 people again this Friday?
But I think for terrace, no, I'm not that preoccupied, because I think restaurants are going to have specific. They have recommendation, and it's going to be well encadré. It's well contained. And for the in backyards, I think it's the same thing as we see in parks. what we have to be careful is making sure that people do not come in the houses and that we do not continue the party or the supper inside where there is a lot of higher risk. So I think the same measures do apply in your backyard or in a park.
Parfait. Et on termine avec Jacob Serban de la Presse canadienne. Jacob, you can ask your questions.
Hello. At the beginning of the press conference, Dr. Drouin, you said, and I think this is the first time you said, that we have avoided a third wave here in Montreal. What would you credit to that success? What happened that allowed us to get out of this without seeing things get worse when they got worse in so many other places?
I think it is difficult to identify only one factor linked to the success that we had in preventing the third wave. It was like in public health, it is a multi-strategic approach. First, we started really soon at the beginning of February with some laboratories in Montreal to identify those variants. We changed completely our approach with, as I was saying, with a suppressive approach where we identified more contacts. We closed school groups and workplaces really rapidly to make sure that the progress of the variants was really slow. After we asked the government to increase the number of vaccines in Montreal at the beginning of March, asking them so we could accelerate the vaccination of the vulnerable population, and we did so, and it worked really well. We were first at this time in the vaccination campaign. We did also a specific pilot project in 2 neighborhoods where we had high incidence of variant, and so we vaccinated all the parents of the school age, and this did reduce the incidence rate in those neighborhoods. So we think it has had an effect on preventing the spreads of the variants. And of course, because the populational measures did not change, what we had as measures in January were still there with some small changes. The population was with us and did maintain high adherence to the public health measures. So all those factors did contribute, and I think right now we understand, we have more knowledge on the virus. We do understand how it is transmitted. We have an approach to variant that did work. So if we've put all the conditions in place to make sure that we were in a suppressive approach. So that's.
And my other question. We've been talking a lot about the vaccination campaign. When I look at the numbers from the INFTQ, it seems that Montreal, at least as of May 24th, has the second lowest vaccination rate amongst the regions of Quebec. What do you think is sort of leading us to be less vaccinated in Montreal than almost everywhere else in the province?
I think there is different reason. As we were first in March and the beginning of April, we had to wait to reopen to other groups of age because the province to be at the same speed as the rest of the province, and because there was fire in other regions, we did send some of our tens of thousands of our vaccine in other regions, and I think it was a good decision that the government made. And at the same time, we vaccinated more than, I don't know today the number, but it is approaching 200,000 people that live outside of Montreal and that got their